Wisconsin Governor Tony Evers has signed the state budget. It's an $87.5 billion two-year spending plan. The final budget is not what the governor originally proposed. Republican lawmakers actually rewrote the budget. It was passed on the Assembly on June 29th and in the Senate on June 30th. It was signed into law by Governor Evers on July 8th. This budget includes over $2 billion in tax cuts, and it involved heavy use of the governor's veto power. He didn't veto the entire budget, however. He was afraid, he said, it may jeopardize some federal aid for schools. And while the healthcare pieces in the budget were not what the governor originally envisioned, the finalized budget did include some support for healthcare and coverage, and we'll review a couple of those pieces. First, it increased some Medicaid dental reimbursement rates. It increased reimbursement rates for some nursing home, personal care services, and direct care providers in family care as well. It also put more money into some of the hospitals that serve a disproportionate share of low-income individuals through the disproportionate share hospital payments, or DSH payments. Also included some investments in mental and behavioral health, including increased reimbursement rates for outpatient mental health and substance use disorder services, increased reimbursement rates for child and adolescent day treatment, and increased reimbursements for autism services for adaptive behavioral health treatment. There were a couple more investments as well, some increased funding for community health centers and free and charitable clinics. There was some funding to add some additional dementia care specialists, including some tribal dementia care specialist positions. And it fully funded the Wisconsin Healthcare Stability Plan to help reduce some of the premiums paid by individuals who purchase insurance on the individual market. It did not do a lot of the things. Like we said, this was not the budget Governor Evers proposed. It did not expand Medicaid. It refused the enhanced incentive to do so offered by the American Rescue Plan at the same time. It also did not expand Medicaid's covered benefits. Instead, it gave a small boost to some of the reimbursement rates to providers. So we didn't get a big service enhancement. And the proof still is in the pudding of whether giving more reimbursement rates for some of the services is actually going to increase access to care for the patients. The increases at the same time in some of these reimbursement rates were also more modest than what the governor's original budget would have included. It did not expand postpartum coverage in Medicaid for 1 year, as the federal government allowed in that American Rescue Plan. It did not fund any other efforts to address maternal and child health or health disparities, and it did not fund civil legal services. Also, it did not include what the governor had included as a $200 million investment in broadband infrastructure, nor the expansion in services for homeless individuals, nor that incremental change to the minimum wage. Governor Evers, when signing this budget, said there's still unfinished business, and he called on the legislature to work with him to achieve a couple more objectives. In his veto message, Evers said this budget isn't good enough for our kids, and there is more work to do if we want our economy to continue to recover. Wisconsin's two-year budget cycle begins July 1st. The new budget is effective upon being signed into law. And in the description below, you can read the governor's veto message. You can read the entire budget as it was published.